Good evening, Postal family. What's going on? My name is Saeed. Welcome back to my channel. How's everybody doing today on this nice Tuesday evening? How's everything, fam? We got an article today going over our healthcare increase coming up. The annual enrollment is, I believe, next month. So we're going to see a nice size increase in the premium payment. So I want to go over some of the details, how much increase we're looking at, all that. But first, if you're new to the channel, my name is Saeed. Postal content is what I do. And if you like postal content and anything to do with the service, I would appreciate it. Go ahead and subscribe. And I love all your comments. Y'all been leaving me all the detailed comments. Thank you so much. Keep giving me the thumbs up. Really helps out the channel, helps out the video. Thanks so much for all the supporters out there. I can't thank you guys enough. Very respective of you guys. I'm right there with you. I'm a carrier too, so I see everything what's going on. So as far as the contract, I had the update last video, so once I have something new, I will definitely be sharing with you guys as soon as I can, as soon as I have it. So anyways, let's get to today's topic about the healthcare, the premiums about to go up. We're gonna see federal workers will see the largest increase to their healthcare premiums in recent memory next year. In a year where insurers have expanded coverage for multiple medical treatments, federal employees will see their federal employees' health benefits program premiums increase by an average of, get this, 13.5 in 2025. Wow. We need that contract yesterday. We gotta have it. Things are going up everywhere, left and right. That contract needs to get here ASAP. It's a must now. It's not a laughing matter. Federal employees and retirees will pay an average of 13.5 for more than their health care premiums in 2025, a figure that is nearly double last year's increase and marks the largest price hike in recent memory. The government's share of federal employees' health benefits program premiums will increase by an average of 10.1%, bringing the overall premium increase to 11.2%. In 2024, civilian federal employees were estimated to pay an average of 7.7% more on premiums than the previous year, a slight decrease from the 8.7% rate hike in 2023. The largest the program had seen in a decade. On average, federal workers enrolled in self-only plans will pay an additional $16.24 per biweekly pay period, while feds in Self Plus One insurance plans will pay $33 more per pay period. Employees enrolled in family coverage will pay an average of $26.10 more per pay period next year. Under the federal employees' dental and vision insurance program, the average premium for dental plans will increase by 2.97%, while vision plans will increase by an average of 0.87%. 2025 marks the first year of the Postal Service Health Benefits Program, which replaces the U.S. Postal Service's previous health insurance offerings, as well as the mandate to pre-fund future retirees' health benefits. As part of the shift to the new program, USPS employees will see their portions of premiums increase by an average of 11.1% next year, while the government's portion will increase by 5.1% on average. On a bi-weekly pay period basis, Postal Service workers enrolled in self-only plans will see their premiums increase by 10.4%, while those in the Self Plus One plans will increase $29.93 on average pay period. USPS employees enrolled in family insurance coverage will see their premiums increase by $30 on average next year. The FEHBP and the PSHBP's annual open season, in which federal and postal employees can choose from a variety of regional and national insurance carriers and coverage plans, will run from November 11th through December 9th. Among the drivers of this year's premium increases are price increases from both providers and suppliers, increased use of some prescription drugs, and increased behavioral health spending. OPM and the White House on Wednesday announced that beginning next year, multiple national and often several regional FEHBP and PSHBP insurance carriers offer comprehensive IVF coverage to the tune of $25,000 or more. Also new in 2025 are requirements that all federal employees' health benefits carriers cover at least GLP-1 class anti-obesity drugs such as Ozempic or Wegovy for weight loss treatments, alongside 2 additional oral anti-obesity drugs. Carriers must also offer comprehensive behavioral therapy, including diet and exercise regimens, to those prescribed those drugs. Wednesday's announcement that OPM had negotiated expanded fertility coverage come as welcome news to federal employee groups and Democrats in Congress, who have been lobbying for expanded access to IVF after the Alabama Supreme Court briefly banned the treatment last spring. I applaud the Biden-Harris administration for taking this decisive action that I've called for to ensure all federal employees have access to IV coverage, because everyone deserves the ability to access the fertility treatment they need to build their families. No matter where they live, Senator Tammy Duckworth, while this is a welcome news, any future president could reverse this decision. So it's critical we permanently protect and expand access to IVF nationwide and ensure no patient or doctor is criminalized simply for trying to start or grow their family. Lots of details. In 2025, every federal employee's health benefits enrollee, regardless of where they live and work, will be able to choose from multiple nationwide plans and offer comprehensive IVF coverage, said Representative Jerry Conley. Additionally, every federal employee's health benefits plan will be required to cover the prescription drugs required for 3 cycles IVF annually, ensuring every enrollee in the country is able to choose a plan with fertility coverage. Providing federal employees with options to start and grow their families will in turn help the government recruit and retain the federal workforce of the future. Stacey Young, president of the Department of Justice Gender Equality Network Employee Association, made up to nearly 2,000 employees at the Justice Department, that has been on the forefront of lobbying OPM to require additional fertility coverage from insurers, said 2025's additions will help retain a highly qualified and diverse workforce. President Biden, Vice President Harris, and OPM have again shown their commitment to federal employees' reproductive health care needs, she said. Many DOJ members, like countless workers across the federal government, have endured hardships without adequate IVF coverage. We expect that expansion of access in 2025 will provide many more of our nation's public servants with the ability to grow their families and to do without extreme financial struggles. But the rate increase is a bitter pill to swallow for other employees groups, particularly given the 2% average pay raise feds are slated to receive in January. 2% average pay raise feds slated to receive in January. Something good. I mean, I don't know how that figures into our pay with the current contract situation, but any increase sounds fantastic. This is the highest health insurance premium increase in more than 2 decades and will stretch employees' paychecks beyond what they can afford, said Dorian Greenwald, National President of National Treasury Employees Union. I call on President and Congress to take immediate action on providing federal employees with an average 7.4% increase as called for by the FAIR Act. Hey, any increase sounds good. Get it coming. William Shackelford, National President of National Active and Retired Federal Employees Association, urged federal employees and retirees to look closely at their coverage options during this year's open season. These increases are unwelcome news that will no doubt cause sticker shock for federal and postal employees and the retirees across the country, he said. But that sticker price may not be what you pay if you compare plans and shop for a more affordable alternative. All federal employees' health benefits and postal service health benefits plans offer comprehensive coverage. So it's difficult to make a bad choice, but you can leave money on the table if you don't compare costs and options. Wow, guys, a lot of good info there about the upcoming enrollment. Again, just want to clarify disclaimer, actually, say that just because I'm reading an article that mentions a certain political party doesn't mean I'm with them. I've said this before. Anytime I read it as an article, I want the information I'm passing to my followers. That's it. I stay neutral. I don't support any political party. I have been like that for the past few years. I just like to stay neutral. That way there's no confusion that I'm going with this party or I'm going with that party. I like to leave that alone, just passing the info to my followers. Anyway, about the article, just the different increases coming for us in next month when enrollment arrives. Another worry, actually, we haven't gotten our contract obviously yet, so a lot of us already are working 2 jobs to make ends meet, and this is a very unwelcome expense increase to our premiums that's going to hit us. And but still, without medical insurance, it's kind of tough. So one way or another, we're going to have to get a look at all the plans, adjust them in somehow, whether or not you have family plan or the individual. Regardless, all plans are going up. So that's why, all of us desperately waiting for that NALC contract. All the news we're focused on. Anything new comes on, I will definitely pass it on to you guys. And, hopefully we're praying that it gets here sooner rather than later. It's been close to 600 days now. Our president says we're very near, but he's been saying that for the last, 4 months or something. He keeps saying we're near finalizing tentative agreement, this and that. But until we actually see it, we won't believe it. So that's about where we are at. Just wanted to pass along this information about the upcoming healthcare enrollment, about our medical plans, which one you need, and another worry for us carriers. So again, if you're new to the channel, my name is Saeed. Postal content is what I do. If you like this kind of content, and really appreciate it if you go ahead and subscribe. Keeps giving me the thumbs up, guys. Really helps out everything. And keep the comments coming. I've got really informative comments from some of my followers. I appreciate them. Thank you so much. Very informative, very, kind that you guys help me out like this with information. I really appreciate it. So thanks so much for all you do, all we do. And if anything, stay positive out there, stay focused, and biggest of all, stay safe out there. If I have the news about the contract coming up, I will definitely share it with you guys. Have a blessed night. Thank you, guys. Take care.